All right, we're taking calls for Dr. Zorba Paster at 608-270-9933. We will start with Philip in Wanakee. Hi, Philip. What's your question?
Hey, my question, and thanks for taking my call, is I've been vaccinated. I've had one booster shot, but I did not do my second booster. I thought I was going to wait till maybe this fall to do it, like about now. But now I'm hearing that they have another booster that's coming out. So my question is, do I get my second booster or wait for the other booster that's coming out?
I would say wait for the new booster that comes out. No doubt about it. So put it off until probably mid-September. That's what I heard. That's when it's going to be available. But somewhere between September and October, it'll be available. And it'll target basically another strain that might bother you.
All right.
All right. We have David from Columbus. What is your question?
Yes. Sometimes I have double vision. What causes that?
Well, double vision can be caused by lots of things. But if you have double vision, that's the time to call your doctor, your nurse, your healthcare provider, because it can be something serious or it can be something benign. Very, very important to get it checked out.
Yeah, that's not just something that you
can't
ignore.
answer it. No.
All right. Let's go to Ron in Stoughton. Hi, Ron. What's your question?
Just wondering, I think my question got answered, if there's going to be a fifth booster coming up.
And the numbers, you know, it's kind of interesting. You know, it may be a fifth booster. I have no idea how many flu shots I've had. The reality is, I think this is going to be an annual thing, and we're just going to learn to live with it.
So, and don't forget the flu shot.
That's right. Don't forget the flu shot. Right.
It's important for that as well.
Andrew from Middleton, what's your question?
Hi, Dr. Pastor. I'm a big fan. I was just wondering, do I need to wear a surgical mask? Like, is that doing anything at all when I go grocery shopping?
Oh, I think they really do make a difference. And I think you do it on an individual basis. You know, when you think about it, where are you coming into contact with people? Grocery shopping, going to a store like Quick Trip. I once counted how many people I was near on Quick Trip, and generally it was about 12 to 20 by the time I was finished, and you're in close quarters. So the reality is, if in doubt, wear a mask.
Okay. Right. Let's go to Mary now in Madison. Hi, Mary. What's your question?
My question is this. I currently have COVID. Do I get the new booster when it comes out in the fall, or do I wait? How do I handle that?
Absolutely, you get the new booster when it comes out in the fall. Now, the reality is now that you have COVID, you've got sort of the golden ticket where you can go around. You're less likely to get COVID over the next 90 days. But once you go beyond 90 days, then you're going to possibly get it again. You need the other booster. Absolutely.
Mark from Madison, what's your question?
Hey, Zorba, how are you?
Good, thanks.
Say, I have a question. I've been reading that current research is that there may be some effect to heart and brain as it pertains to being infected with COVID. I had COVID about 6 weeks ago, and I had an episode as a result of it, and was just wondering if you had seen any current data on that.
Absolutely, there's data on it. We know that the inflammatory response from COVID can cause a whole bunch of things. We don't understand long COVID, but we know that it definitely has an impact. And I think we have to look back to things like polio. We know that people who had polio back in the 50s and the 60s have now a problem later on, 50 and 60 and 70 years later. So the answer is, yes, it does have an impact on the heart and brain. We don't quite understand it, and that's where new research is always coming out.
Which really emphasizes why young children should get the shot.
Absolutely.
Because they're going to live another
Absolutely.
50,
You know,
years.
The idea of not giving your kids a shot is sort of like you don't want to give them a tetanus shot or a polio shot. Young children should definitely get COVID booster shots. The initial series, it's very important for them. Right.
And it seems so much COVID out there. Everybody, callers are calling in. We have people in here.
It has not gone to the wayside. It is here to stay. And people are still interested because they're worried about it. And the fact is, we should be worried, and that's why we still have people in Wisconsin who have not gotten boosted. And if you know somebody who's not gotten boosted, talk to them, because chances are many of them just haven't gotten it together to actually get boosted. I've had people who come in my office and they've said, especially young men, you know, maybe I should do it. I just haven't had the time. And the answer is, take the time and get boosted.
And right now, and we talked with another doctor about this, but the BA.5 variant is still the main one. Is there any encouraging info that we can glean from that another one hasn't taken over yet?
Right. The answer answer is,
Yeah.
who knows? That's it. We really don't know what's going to happen in the fall because it's going to continue to actually, I mean, that's what RNA viruses do. They continue to basically mutate into something else. And I think just like influenza, the FDA looks and the CDC, what's the best influenza vaccine for the year? We're going to do the same thing with COVID.
And colds. We've had colds all our lives.
That's right.
That's the
Yes,
same.
we have.
That's a COVID. It's a COVID virus as well. All right, we are out of time. Zorba, thank you.
Pleasure to be here.
Thank you all for calling in. We'll see you next week. I think there's some phone bank thing we're doing next week.
Yes.
Back to
Yes.
school. We'll see you then.